Great. So again, good morning, everyone. Thank you so much for being with us here this blustery, cold Friday. I'm just going to quickly introduce myself and my colleague, Esther Bejarano. I'm Sarah Fleming with United Way of Colchester County, and Esther is with this is a mouthful, so my apologies, Esther, if I get it wrong. She is the coordinator for the North Shore Local Immigrant Partnership program coordinated through the YMCA of Halifax, Dartmouth. So this morning, we're going to go over coordinated access and what that can look like in Colchester County and the why for coordinated access. We, just to give a little bit of context, started this sort of, housing exploration process back in October of 2019. So some of you are familiar with our affordable housing needs and demands study that was facilitated from January 2020 until about July of 2021. So through COVID, it was quite the process, like most things, but we are, have successfully completed it. And I think it really provided us with some insight that we knew, but showed us the data to support the knowledge that the community already possessed. So when we look to next steps and what that looked like for Colchester County, coordinated access felt like a good fit in terms of how we are working with folks who are unhoused in an equitable way moving forward. So we are hoping that you will also feel the same and want to pitch in and help us make this system work here in Colchester County. But without further ado, I will introduce Lisa Ryan, and she will take us through paving the way to home through coordinated access. Thanks so much, folks. I will be monitoring the chat, so if there's any questions, please put them in there. And I just ask that you stay muted, and we will I'll keep an eye on the chat, and then at the end, there will be time for questions. Thanks so much.
Thanks for that, Sarah. Hi, everybody. So again, my name is Lisa Ryan, and I'm going to be walking you through this presentation on coordinated access. Before we jump into the agenda, I'll just give you a little bit of background of who I am and why I am doing this presentation. My history is I've been working within the housing and homelessness sector since 2015. I have my own personal lived experience of homelessness, and I rely heavily on people with lived experience to help contribute and to help lead these kinds of systems in different communities. I've been able to work in a capacity of an outreach street intervention program. I was also one of the key partners in establishing the City of Moncton's first out of the cold shelter, which was, really advocated for through coordinated access data. And as well, I managed the coordinated access system for the City of Moncton for a few years before I came to Nova Scotia, and have most recently been working with the town of Bridgewater and other municipalities in Lunenburg County to establish coordinated access systems in a rural context in order to address the rising situations of housing insecurity, energy poverty, and homelessness that we're seeing within our county. And I am very certain that other counties across Nova Scotia and across Canada are seeing. So I guess we'll just jump in. I also do want to let you know that I am very happy if you feel that you would like to put your hand up while I'm doing the presentation. If you have a question or a concern, I like to have conversations, but in order to save time, I think it might be best to try to hold off to the end. Any questions you have, feel free to pop them in the chat if you're worried about forgetting, and we'll try to get to that. I'll also provide my email address at the end if anyone wants to send in any questions or have any kind of conversation with me one-on-one. All right, so I believe it's Esther that's controlling the screen. Esther, if we can go through the agenda very quickly, that would be great, which is just the next slide. All right, so this is our agenda for the day. It's going to be very long. I'm going to try to make it not boring. But our first thing that we'll do just next after I go through this is our land acknowledgement. I'll go through some definitions, what the purpose of coordinated access is, and what is the philosophy that coordinated access operates on. I'm going to highlight some of the pillars that help the system operate, and then we'll go through a scenario so that you can see or at least have an idea of what the system could look like in action and what I think a proposed timeline for your for Colchester County to actually establish a coordinated access system will look like. So before we get started, I'm going to ask Esther if you can go to the next slide, which is our land acknowledgement. I'm going to ask everyone, as this is Friday and the weight of the week is on our shoulders and we are tired, I'm going to ask everyone if they could to please place your feet flat on the ground. Take some deep breaths. Let's let go of the things of the week as we take a moment to acknowledge that the land we stand on is Mi'kma'ki. And this is the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the treaties of peace and friendship, which, unlike later treaties signed in other parts of Canada, the treaties of peace and friendship did not involve surrendering rights to land and resources traditionally used by the Mi'kmaq peoples. We must ensure, as we move forward and as we do our work, that our acknowledgement becomes the lens through which we plan our work, as acknowledging territory is only a small part in cultivating a strong relationship with the First Peoples of Canada, who are the caretakers of this land. Let's use this lens as we approach the concept of coordinated access and as we approach our work and how we live in Mi'kma'ki to guide as our guiding post and our guiding light to move us forward. Thank you for honoring and taking the time to acknowledge this very important practice. Okay, let's move into the purpose. So, Esther, you can switch the slide there. What is coordinated access? Lots of people talk about it, but what actually is it? It's really important to know that, oh, can you go back? Yeah, there it is. It's really important to know that coordinated access is not a program. Coordinated access is not a program, it is a system. And it is a system that is established to bring consistency to the process by which people who are experiencing or at risk of homelessness access housing and other related services within a geographic area. This is not in competition with existing agencies or their work. What this does is provides the support needed to the agencies so they can do the work that they have been mandated to do and bring resources together to ensure equity and access for all. It also, as you'll see later, will give us data that can help communities establish strategic planning and move the communities forward to the desired goal or outcome that the data is showing needs to be addressed. The next slide, please. So again, using that system, the purpose is to collect real-time data in your community, to gain in-depth knowledge on what your community needs are, to help create and ensure equity and access to resources, and to establish a community-wide shared work ethic. All of these things will lead to data-driven solutions to your housing insecurity and homelessness problems. This will give you that core data that you need to understand exactly what is happening in your community and how to address it and how to leverage the existing resources that you have to make powerful impact. The next slide, please. How this system, as the slide's coming up, how the system ensures that equity is by using a housing first philosophy. Not every community can do housing first as a practice because especially in rural communities, not many of us have nonprofit owned housing units to be able to establish an actual housing first model. But we can use the philosophy in how we operate and work within our systems. The housing first philosophy, the principles include immediate access to housing with no housing readiness conditions. It includes consumer choice and self-determination by the individual that is seeking the housing. It's recovery orientated. It means that people, while we don't demand sobriety or abstinence, it can be a powerful tool, to move people towards recovery if they so choose, because it is also individualized and it's person driven, and the supports that the person receives are person driven. So they're the ones that identify what they need and who will be able to support them. It very much includes social and community integration. And this is a powerful tool that most of us do not have the capacity to do on our own. But when we come together as a collective, we can help provide social and community integration for the folks coming through our doors through a community-wide lens. That's the purpose and the philosophy of the coordinated access system. How it operates through that, Esther, I'll get you to go to the next slide, is through certain what we call pillars or certain factors. These are the elements that the system uses to help bring consistency and bring the community together. And so we use different things called access. So your access points, how people will come into your system, is very important to map out and to understand as a community. Your assessment tool is an assessment that is used by everyone so that you have a very concrete data coming into your system that can be measured and that can be looked at from a funding lens and from a strategic planning lens. You'll have a by name list, which allows communities to understand and to bring people to the list and for them to be known by their name and by the experience that they wish to share, not by our assumptions. It brings dignity to individuals by allowing prioritization. So prioritization in your community on who needs the services first, or how you want to strategically address the issues. This is, again, all community determined, and we can go into it a little bit later. It will also use a matching and referral process to ensure that all individuals coming into that list are served and that none are overlooked. And it will include an evaluation method so that the community can ensure transparency, but also that the direction that the system is going in is accurate and is leading towards a solution and towards the desired goals. So the first one, I'll get you to go to the next slide. We're just going to be talking about the role of assessment, because this is probably access and assessment to your system is probably one of the most important factors on how the system operates, and also the data that you will receive. And I know that these slides are a bit wordy. I don't typically put a lot of words in the slides, but I will. I did put a lot of words on these slides because I would assume that every individual on this call would like to have it to be able to review. So just be assured that we will share this so that you can have it and so that you can review it on your own time. Access and assessment is going to give you this information on who is experiencing housing insecurity or homelessness within your geographic area. Who are they? What is their background? Why are they experiencing housing insecurity or homelessness? A lot of us right now across Canada, and especially across Nova Scotia and right now in New Brunswick, are seeing rent hikes or rent evictions as being a leading cause of some of the situations of housing insecurity and homelessness in our areas. But we don't actually have core data around that. Through a coordinated access system, you can begin to measure how many evictions are happening within your community, what are the reasons behind that, and use that in your advocacy towards tenancy rights or rent control or whatever various issues that you want to be able to address and to make solutions from. Where are they located? Are there any hotspots in your community? Is there a certain area that maybe recently went up for sale and now all of a sudden you're seeing an influx of individuals? Is there perhaps an area that has abandoned buildings and we know that people are sleeping there? Where are the access points, or where are the locations of those who are sleeping outside? How do we have a community plan to reach them or to include them in in the solutions or in allocation of resources. When did it happen? When did the individual or family situation of housing insecurity or homelessness begin? And when have they accessed services in the past? Is there any record of any kind of referral or resource that has worked, and what didn't work and why? Oftentimes we end up blaming the individual coming through for for maybe a resource or a referral not working. But if we're truly wanting to address systemic issues, then we need to be reflective on why that didn't work. Perhaps the individual wasn't ready for that referral. Perhaps it was a cold handoff instead of, a support worker walking them through that referral or introducing the people together. There's so many factors, but if we don't understand why things aren't working, we can't adjust to ensure that they are working in the future for as many individuals as possible. This is the data that you can have through your assessment tool and through your intake model. Let's go to the next slide, please. The role of the by name list is, again, it's giving you information on the real-time list of all known people experiencing homelessness or housing insecurity in your community, if you so choose to include housing insecurity. What that means is at any given day, you should be able to look at your list and say, there are this many youth, this many seniors, this many women, this many individuals, this many people coming from incarceration. You should know from a very detailed perspective who in your community is experiencing homelessness and why. It will also provide a set of data points that will support coordinated access and prioritization at a household level. So this means you will be able to prioritize individuals to resources based on what they have identified as their need, and you can go as narrow as a household level. It's going to provide a deeper understanding of your local situations of homeless inflow and outflow at a systems level. Are people coming into your system because they're graduating out of foster care? How do you measure that? How do you know that? That can be included in your by name list. That's an important thing for communities to understand. It's an important thing for the government to understand so that they can change policies that may need to be changed, or so that they can support programs to ensure that those gaps are closed. And it supports triage to services system performance evaluation and advocacy. This is a fantastic way to use this data to be able to include your local activists, your advocates, your housing coalitions, each one of your agencies when you're doing funding supports, to have this data to know what is working, what isn't, and how many people in your community need the assistance helps increase the capacity and the voice of the community in moving forward. We'll go to the next slide, please. In the role of prioritization, matching, and referral, it provides the clear and transparent process that both connects clients with appropriate resources and helps communities reach their goal. There's no secrecy in the doors. There's no one person that you have to contact because they have, the secret key to getting a subsidy. This becomes community knowledge. The resources become community accessible, and it's shared. The knowledge is shared so that if you have somebody that in your community, like I know in our community, we have so many individuals who are close to retirement and they hold so much knowledge, and we're going to be lost if we don't have that knowledge. So creating a community method to be able to hold that knowledge and increase that knowledge and ensure that it's accessible to everyone working in the sector is so important to continue the movement forward. It's also a way to base local decisions about resource allocation on an agreed upon standardized process shared across your community. This means that instead of vying for funding pots, we can support one another in how to access different funding pots. We can use this data to be able to, again, create those community plans and strategies to move forward and look at the resources that we have that are existing and ensure that we're using them appropriately. And it will help focus very narrowly and broadly our housing efforts and limited program openings to those who need it most, all the while building up our community resiliency by offering more looser supports to individuals who may have community resources already. They may have a natural network from their family or friends. We can keep them safe and allow them to not become reliant on a system to move forward on their own, but also focus on assisting those who may not have that kind of support naturally within the community that they find themselves in. And it gives us a deep understanding on client housing needs, what their interests are, what their choices would be. We're matching and offering people housing. We're not placing people in housing. Giving people the choice on where they live, understanding what it is, what kind of housing they would be most successful in, means that our referrals become more informed. And the anticipated result is that we see less of a cycle happening, that we end that cycle of people coming back, that we end the cycle of evictions and the burnt bridges with landlords, that we support the landlords that are supporting our work and that are willing to work with us, and that we continue to build on those supports so that we can invite other property management companies and landlords into this, and they become our partners instead of the right now, the clashing that we're seeing so strongly. We'll go to the next slide. Actually, I want to just stop right now. We're going to stop on this scenario. You can leave this slide up, Esther, but I want to make sure that there's no pressing anything that maybe somebody wants me to clarify on, or if I need to go back and explain something again. If there is, can you just put your hand up or put something in the chat? I just want to make sure that everything is okay. Not seeing anything yet. Okay. I can tell you as we move forward, I can tell you a lot about the system, but sometimes I think it's better to try to understand the system. And I'm a visual learner. And so I found that this was a very powerful exercise for me to go through when we as a community in the city were looking at establishing coordinated access. And so what I'd like to do is just set up this very quick scenario that I think most of us would be familiar with. So we have our local community and we have multiple agencies that work within the community. And oftentimes when I talk to different communities, I hear that the comment that, you know, the community is very good at collaboration, that we work together, that we share resources. And it's very true. There's a lot of communities that do work really well and they do share resources, but they're still missing that coordinated piece. And so oftentimes, even though they are sharing some information, they're still working in a very siloed environment. And so usually what we see, for an example, is agencies, again, sharing resources, they may communicate well, but when it comes to serving a client that walks through the door, it is now their client and nobody else has the capacity or the consent to enter into that work with the agency. And so under that premise, I'm not suggesting that your community operates such as that, but under that premise, typically a scenario will happen. And I want to kind of outline what generally happens in communities without coordinated access. So if we can go to the next slide. The next slide is going to show just an example. So we have 3 individuals that have come forward at the different agencies. So agency A has received a call from a woman named Jane. She's a single mom. This is the information that they received on the phone call. She's employed, but she's recently received her notice that her building has been sold and she needs to vacate. And so she's calling, looking for some assistance on some housing. At the same time, agency B has received some calls about Craig. He's known to the community. He typically couch surfs. He was recently incarcerated for theft. And most community agencies are aware that Craig is known to have some angry outbursts. Agency C and D both received a call from different social workers about Stan. Stan is he's a recently widowed man. He's living on old age pension and CPP and was recently hospitalized due to deteriorating health. All three of these individuals require housing. Typically, in this situation, the agency that receives the call then looks in Kijiji or looks, online to see if there's any units that are available right now in the area. They may call the province and see if a housing subsidy is available. And they locate on, let's say, Kijiji or a Facebook marketplace, that there is a unit that has just come forward, and it's walking distance to the hospital, to the grocery store, to the schools. It's on a bus route. It's close to parks and other outdoor recreation centers. It has a reasonable rental price, and it has an amazing view. What a wonderful apartment. It sounds like, the golden egg that all of us are always searching for. So this is the apartment. Esther, if we can go to the next slide. So all of the agencies have this information. Agency A, Agency B, Agency C, and Agency D all know that they have individuals. They all know this unit is available. They're all vying for the same unit. They don't know. Agency C and D may not be aware they're assisting the exact same individual. And so double manpower begins to be used to identify if this housing unit would fit Stan's situation. The landlord is receiving all of a sudden now an influx of calls from all over the community, and they're maybe wondering, well, why is everybody vying for this one unit? They have none of the agencies will have any way to document or measure if referrals to one another have been successful. And this is incredibly important, especially during the winter, when we're in the middle of a peak crisis event, like when we find out that there are people sleeping outdoors and there's an oncoming storm. Even assisting struggling community members can be viewed as competition between partners. And I can tell you that right now, currently, I'm helping another community walk through this very scenario. It's the winter. They're trying to put together a strategic plan. And it's very difficult because partners view it as competition. If they receive funding to help develop this, then it's unfair to the programs that already exist. That's the concept and the belief, but that is not the truth. Anyways, this is what a siloed approach can lead to, which in the end doesn't serve anyone. Can we move to the next slide, Esther? If we use coordinated access to address these things, we're going to have a few tools that currently don't exist in communities without coordinated access. All of the tools put together gives us information that's not siloed just to one agency. All of the data then becomes community knowledge, and all of the decisions are made as a group for the community through predetermined models that the community has put forward. Then the units are prioritized based on needs and preferences. So let's go back to let's go to the next slide. And I want to just show what the difference is of information received when we use a coordinated access model. So under the coordinated access model, we learn that Jane is a single mom. She's employed, but she's working 2 minimum wage jobs. She has an excellent rental history. She's recently received notice her building has been sold and she will need to vacate in the next 6 months. And she needs help with resume building. Craig, as we are aware, is known to the community because they've been part of local youth programs. The reason they're couch surfing is because of increased violence at home. And they were recently incarcerated for repeated thefts at the local grocery store because they were trying to find food to eat. They're known to have angry outbursts since not having access to their medications. So there's some key factors that we don't always know about until we ask pointed questions to an individual. For Stan, yes, he was recently widowed and he is living on OAP CPP. He was hospitalized due to deteriorating health from inadequate and unsafe living conditions. He will require ongoing medical care. He's on a current wait list for a local seniors complex, and he has family members who are willing to support his living situation. With the unit under a coordinated access system, we have the potential partnership of a landlord who has updated the system planner first before advertising it that the unit will be available the first of the month. The landlord, because of advocacy and work through the coordinated access system, has an agreement with the coordinated access system to prioritize up to 5 units when they become available for clients referred by the system, as long as agencies provide wraparound supports. The unit, again, is walking distance from the hospital, grocery store, and schools. It's on a bus route. It's close to parks. It has a reasonable rental rate, and it has that amazing view. I like to throw that in because I think I'm just putting out my wish list. I want somewhere with an amazing view. So under the coordinated access system, it's filling in some missing gaps. And I like to ask, I'm curious, who do you feel would be the best fit for this unit? Given the information that you just heard, anyone can answer, pop it in the chat. I'm just interested to hear all of that information. Who do you feel would be the best fit for that unit? Get some responses now for Craig. Anybody else care? Jane, okay. You're welcome, Krista. I like breaking stigma. It's my favorite thing. Anyone else care to toss in a vote? Or at least an opinion? All right. Thank you, Karen. Well, let's do a drum roll. Esther, if you don't mind going to the next slide. It's the best match is Craig. Good job. Now I'm going to explain why. There's a few things that we can see that puts in places Craig as the best match for this unit, because there's a support agreement with the landlord and the community, and because of the community partnership, Craig fits that model. He is, out of all of them, one of the only ones that require actual housing support. Stan, through ongoing conversations, is able to reside with his family members. They said that they would be able to support his living situation. The other aspect of this is when you find out that Stan is on a wait list for a senior's home, there is an added advocacy or possibility that the agencies or the system can help advocate for Stan to be pushed up in the seniors wait list. He may be able to receive housing that month. He may be able to have a social worker involved and a family involved to have a better placement, or again, because his situation is he wasn't able to return back to his home because of deteriorating living conditions, they can deem that an emergency and hopefully find a placement faster than just waiting on a wait list. And for Jane, she really only needed help building a resume. Because she had 6 months to kind of look for housing. She was fully capable. She has excellent rental history. And so really the only thing that Jane would have required really is a referral to an employment readiness program so that she has the assistance to be able to help update her resume and practice her interviewing skills. And congratulations, Jane. She has 4 interviews lined up for next week. So she's on her way. But instead of us rushing into making a decision based on that phone call, and I'm speaking from experience, in my experience, that often happens because when we get the call, we're already running from the crisis of the day, running off that adrenaline. And as well, the person on the other line is concerned, they're worried, they don't know what their next steps are. And so having these steps before those decisions are made helps us not make poor choices and use resources for folks that might not require them. It helps us to be very focused. There are other ways that, individuals like Jane could qualify for this unit. We might not have had anyone on our by name list who matched this unit. Perhaps Jane, didn't have the piece of needing or requiring supports, but perhaps we could have introduced her to the landlord and just said, Jane's okay. She does not need supports. And maybe she could have just applied through the regular route instead of through the agreement through the coordinated access system. There are multiple ways that we can work together. All I'm saying, I guess all the point of this is we are using our resources as wisely as possible and also gathering data to be able to inform our decisions moving forward. Once the referral is made, we use evaluation. Evaluation helps us measure if that referral was successful. It helps us identify community gaps in services. It can help us prioritize workloads in a shared work environment. So if we see one agency is struggling with strain, it's perhaps gives us the capacity for other agencies to step forward and help support that agency under their roles. And we get to, as a community, celebrate together the many successes that happen every week. This work is really hard, and it's really hard doing it alone. And it's even harder if you don't see the little successes that happen every day. Sometimes it's, in my experience, sometimes it's seeing individuals who are really struggling with using drugs, being able to access services that they weren't able to access before. That's a huge win. Or if we're able to build a partnership with one landlord who's willing to give us 3 units, that's a huge win. These things come together and help build that community hope that often when we're operating under crisis and watching all of the crisis unfold in front of us, we lose. I'm speaking from experience. This has been my experience when the work is hard and it doesn't seem like it's going to end. It's so hard to find those little glimpses that we are on the right path. But when we do as a community, it is so powerful when we come together as a community and celebrate those wins and use those to help measure our movement forward. That's when we see real community change, and it's powerful. So let's go to the next slide. So the data that we gather, it's going to lead to action. It's not going to stay stagnant. This is going to push our community and propel us forward. It's going to do that through shared knowledge. So again, recapping everything I've just spoken about, it gives us access to the same trainings, the same information, the same resources, and the same data. It provides a community-wide lens so that when we're talking about the rates of domestic violence in our communities, we can also talk about the rates of youth homelessness, the rates of seniors that we're seeing needing to access services. We can look through each community agency and be able to map and put together a mosaic of what is truly happening and then make those community plans to move forward. It also ensures that everyone is served. Nobody is overlooked. No one is overlooked because equity in services is built into the policies that help establish the operation of the system. No longer are people, underserved because they may be hard to deal with or because they have, an unmedicated or undiagnosed mental health situation or because they use drugs. None of those things can be taken into perspective when you're moving forward because everyone requires service. Everyone deserves the right to safe, adequate, and affordable housing, no matter who they are or where they are. And we stop burning our bridges. So landlords, property management companies, city staff, government agencies, they all become engaged partners because they can see change led by collaboration. They can see where they fit, they can see how they can support, and we can help them map out their strategy to ensure that our goals are aligned with what their funding pots say or what their goals are for our communities. We can align that through collaboration. I know that it's a lot and I've done a lot of talking and I want to keep a lot of time for questions because I think that's when the real visioning kind of starts in a community. So I just want to quickly go through a proposed timeline of if your community determined that this is what they wanted to do for a next step, this is how I would see it unfolding and what the length of time would be. And I don't want you to get discouraged because a lot of these things take time. That doesn't mean that you can't already be doing some of the work of the coordinated access system while you're establishing these things. So we did the presentation today. I would say that if you decided as a group that you wanted to pursue this, then you're going to establish a strategic planning team as early as next month. That strategic planning team's first work will have to be on what governance model needs to be established to actually run the system. There are multiple governance models that are recommended through Canada's Reaching Home, which is the national housing strategy. And so there's models of the governance being held by your community entity, which would be Affordable Housing Association of Nova Scotia. And they would be the governance model that kind of oversees and operates the system. There's also models that have municipalities as the governance model or overseeing the coordinated access system in a local area. And there's other models that suggest that you could have a existing nonprofit oversee a position and be that governance model with a strategic planning team or an advisory board attached to it that would compromise of existing community agencies, stakeholders, landlords, government representative, et cetera. That would be the first task that has to get done because oversight is needed. Did you have something you wanted to add, Sarah?
I do, yeah, just really quickly, because I
Yep.
know we have a lot of counselors on the call and they're going to wonder who's paying for this is always the question. So in the interest of transparency, I just want to let folks know that funding has been applied for through AHANS to facilitate this work. In hiring a consultant which is Lisa, to move this work forward, but also recognizing the need for community-wide training. So looking at training not only agencies that are supporting unhoused people currently in SPDAT training and how to monitor that data, and also train the trainer opportunities, as well as some management training so that we can look at not just for this year, but what do we need to keep this ongoing in the community moving forward? And how do we ensure whether we're losing staff through attrition or however that looks, that there is someone to train incoming staff so that they're up to date and agencies are ready to go with this model moving forward.
Thanks for adding that, Sarah. As well, by May, once your governance model is established, you should be able to have your access points, your assessment model, and your consent forms finalized, because with the sharing of very private and confidential information, you will have to have explicit consent forms as well as confidentiality policies established through the agencies that will be working together and through your community. Protecting people's privacy is very important, but it also is required to be able to work collaboratively, the sharing of people's information, and that can be done in multiple different ways that all fall under the privacy and confidentiality legal requirements. Most communities across Canada that are implementing these systems have done the privacy studies for their province. And I believe I know for the project that happened in Bridgewater, that all of the documents that were prepared were put through the legal privacy and confidentiality study. So for July, you should have a guide that will be public. This guide, you can see examples at Built for Zero Canada. Well, I think I'll send the link out. I'm not really sure, but if you type in Built for Zero Canada, it will take you to a website that will show you coordinated access systems. It will show you webinars. It will show you by names lists and the different models and templates, but as well, it will show you coordinated access system guides, which is a public document that includes all of the policies, documents, and procedures of how a coordinated access system works. This document is available and needs to be made available to your community so that it is transparent, that anyone can see how the system operates, and it holds the community work accountable to move forward. By September, I would expect then you would do your major system launch. Usually by then you've already done a soft launch and you're starting to collect data. So when you officially launch to your community, it's usually after 3 to 6 months of collecting data, and they will be able to give information on, when you launch, what you're actually discovering already. And by October, you should be on your way. You should be able to have a system moving and in place that can go forward on its own. Of course, with the activity of your strategic planning team, your governance model, and any staffing that you may want to put in place. So that is a quick timeline. There are many communities that have done it way, way quicker, and they've worked out the policies as they've operated the system. It just really is up to you if you determine as a community this is something you'd like to pursue. But I think it's good to kind of have a visual of when and how long this work takes, and what it could look like when you get to the end. Sarah, did you have something you wanted to add again?
No, I'm good. I'm just getting ready for questions.
Okay. All right. Well, I guess that's the end of everything I was going to say. Like I said, I do not like talking all this time. And Esther, would you mind Stopping to share your screen so I can see everybody. Right now I can't see. There, oh, look, all of you lovely people that I could not see while I was talking. Hello. And so now there's going to be a link sent out to you with a survey. And the survey is just a way for you to be able to provide some feedback, as well as if you are interested in embarking on this and being part of a strategic planning team, you can express your interest through that survey. But I do want to open it up to conversation and questions, any concerns, anything you'd like to discuss right now. And if you're not comfortable doing that in a public forum, you can do it through the chat box, or you can email me. I'll make sure that you have my email address, and you can email me and we can discuss it privately if that's something that fits your needs.
I think
Go
Wayne
ahead,
had a
anybody.
question. So Wayne, if you're good to go, you want to take it away around municipal units.
Yeah, I was kind of wondering if you've done any work around defining the role of municipal units. And I'm also curious as to how the province can buy into this, because without a doubt, after the presentation, this is the way to go. A coordinated approach makes sense on every level. But I know the municipality is like, we don't have a lot of money in this, but I know there's a lot of other roles that we can play. So just like to hear a little bit of your thinking around that.
Well, I think that municipalities, if they're willing to even support a coordinated access system, that is huge. Like even having that backing from a municipality to be able to express and say, this is much needed, this is going to help, and to be part of the strategic planning, that is a big role that needs to be filled. As for the municipalities units, if you have units that are able to be prioritized for people coming from the by name list, or if you're willing to say as a municipality, we're going to, if you have 6 units and you say, oh, well, we're going to prioritize 3 to the coordinated access system for them to be able to select and ensure that the individuals that are coming from their list can be there. I don't know if that's what you mean by units. Is that what you were meaning?
No, actually what I was meant by units was, the 52 municipalities in the province. But the other thing I was a little bit concerned about, because I have trouble understanding this, to me, there seems to be a very distinct difference between affordable housing and housing for people that are exceptionally poor.
Yeah, there is. You're right. And so that is something that municipalities can support. So one of the roles of municipalities that it is different across Canada. So for instance, in Ontario, municipalities have the authority and power to be able to distribute provincial housing subsidies. And they're the ones that oversee housing development for their community. So they look at public housing, but they also look at affordable housing development. One of the ways that municipalities can help support coordinated access systems, because coordinated access systems are reliant on a few things. They're reliant on the cooperation and coordination of the community, but they're also reliant on housing. You have to have housing and you have to have resources to place people in. Otherwise, you're just creating a funnel to nowhere, and that's not helpful. Municipalities have a strong role in being able to look at their bylaws, their zoning practices, what they're prioritizing for development, ensuring that there's affordability clauses, looking at managing and mitigating the risks of the rampant loss of housing to Airbnbs, making bylaws about limitations on how many Airbnbs can be in a community. All of those things can lead to more increased development for housing that can then support the work of the coordinated access system. And that role of municipality can become a provincial movement, which then helps the province be able to allocate funds more efficiently and effectively, and to a more targeted and transparent process. So I don't know if I'm answering your question fully, and I don't know that I would have all of the answers, but from my experience and from what I've seen that has been working across Canada, where there's, I think, almost 35 communities that are pursuing, and they're all urban, by the way. So you, I think, would be like the 2nd or 3rd rural community in Canada to be able to consider this model. And I think that's fantastic, because Nova Scotia is now the leader in empowering rural communities to do these things. But in all of those examples, there's so many different ways that municipalities have lended their support to this because they recognize the importance of it. And I'm certain that if your community decided to pursue that, we could get those examples to you, or at least connect you to other municipalities across Canada to give you more insight on what your role could be. Thank you for that question. I think Claire has her hand up, and then maybe Kathy was next.
Yeah, so I guess just building off what you just said about us being one of the first rural areas to implement this model, have you seen a difference in the way that it's implemented in urban areas besides rural areas? Because like in your example you gave with the unit, that was perfect that it was near all the amenities and had easy access to public transportation, but that's not something that's really accessible in Colchester. So have you like noticed any differences in the models in that way?
Yes, I can tell you that I have. So usually urban centric models focus on the hardest to house first. They will usually focus on, because they have larger populations that are more visible in their experiences of homelessness. And because of pressures usually from business communities and citizens, they usually focus their work on the hardest to house. They have more capacity generally to do housing first models. Whereas rural communities have a bit more, I would say, opportunity than urban usually does. And why I'm saying that is because there are different partners that you can invite to help address those issues. So one of the frustrations that we saw recently was when the Rapid Housing Initiative was announced, all of this funding to develop and transition motels, B&Bs into housing solutions. Rural communities, by and large, couldn't qualify for that because, first of all, we didn't have the capacity for the application. And secondly, we didn't have some of the criteria, which was walking distance to schools, grocery shops, sidewalks. They don't consider those little dirt path sidewalks, which most of us have in our communities as sidewalks. So having those kinds of restrictions really dampened our capacity to be able to move forward and do things quickly from a rural perspective. But what we can do as rural communities is we can work together in our regions and leverage the power of a region over just one singular municipality. So, or even counties, you can look at your county and craft plans through your counties. You can also include other partners in your plan that aren't usually connected in a rural in an urban model. So rideshare programs, trying to address different transportation issues, again, looking at where you have housing stock and what client choice is. And then also municipalities can also help back positions that help apply for funding. So if the nonprofits do see that there is an opportunity through a funding grant to develop an affordable housing project, and we don't have the capacity to do that grant, that is something that municipalities can help support by creating a role, or at least providing some talent to be able to apply for that funding as a community together. It's not perfect, but I do also, and I should also mention this, in Lunenburg County, one of the things that they were able to include in their coordinated access system was measuring for energy poverty. I'm going to tell you why that's really important, because energy is not, there's a lot of money in energy efficiency programs, and they've not necessarily been at the table, especially in urban centers, nor has environmentalist groups. And rural communities, especially ones that are living in forested areas or by the ocean, have an added, an added ally that we might not be aware of, where we can advocate for environmentally sustainable, energy efficient, affordable housing that will meet the needs of our community. That means we have access to other pots of money that we might not have thought of before, like Energy Infrastructure Canada, like the CHTC for the strategic planning funding, and to be able to get consultants to help us do seed funding for different housing models that allow us to think outside of just using homelessness funding and bring in partners that we know would be invested in this. So we know from the frontline work that the environmental crisis impacts significantly people who are marginalized. It impacts people who are living on fixed incomes. It impacts people who are experiencing homelessness, and it impacts our ability to have sustainable housing, including environmentalism in our housing development plans gives us a whole other world of opportunity and funding access. And then we can use that to measure and become, again, leaders in taking these complex issues and applying them to our solution. I don't know if that's helpful or kind of answers your question, Claire, but it is something that I think gives us a bit of an upper hand to be a little bit more creative and imaginative when we're talking about our solutions. Kathy, I think you had a question.
I do. Thank you, Lisa, and
Okay.
thank you for your presentation today.
Yes.
And I'm glad you mentioned Lunenburg, because they're doing some very positive things there, and they're thinking outside the box. I like that. One thing I want to stress from my previous career with the tenancy office with the province, getting people in a safe and healthy unit is very important to me. When they're housed, there has to be somebody that oversees that these, just because they're in a unit, is that unit safe, especially when there's children involved. That's something that's always been a real concern to me. The problem is right now is that I dealt with in my previous career, and I'm still hearing as a counselor, is that tenants are living in unsafe units and they're afraid to speak up for fear of being evicted. So I think
Yes.
when we're able to get the housing in place, we have to make sure we've got a safeguard for the most vulnerable, that just because they speak up, they're not going to be evicted. Now, they're not supposed to be evicted. There's supposed to be no retaliation for that. However, it happens. And as we know, the most vulnerable are the most susceptible to that. So that's a concern that I've always had. We need the housing. Actually, I'm going to be speaking to somebody later on another matter about housing this afternoon as well. But I think that's very, very important, because where they get placed, they have to know that they're safe. I just wanted to throw that in. That's a factor that I think is paramount. Thank you, Lisa.
No, thank you. And I think that is a great point to bring up. One of the things that you can do, and I would strongly recommend through if you decide again to develop a coordinated access, even if you decide not to, this I think is important for communities who are working in trying to address housing insecurity and homelessness. Having peer-led groups come forward in safe environments where they can share their experiences and they can share where they feel they want the community to go or their own solutions, and treating people with lived experience as experts. So building into your plans ways to reimburse people for their time and for their activities and for their engagement in your planning structure. This is going to be core, because they're going to be able to tell you those experiences, and then you as a counselor can use that feedback to again push for change on increasing tenancy rights, increasing tenancy legal access. That is something that I'm very passionate about as well. And that is something that is hugely lacking in this province. If you are somebody who is, I'm a working professional, my partner's a working professional. We moved here and ended up in a rental. We had a very difficult time finding a rental in our area that was, first of all, affordable, and secondly, would allow us to live with our child. Like, she's not a cat. I can't just leave her somewhere. And so it was very frustrating. Thankfully, we have a fantastic landlord who has been, just incredible in hearing my feedback and trying to be part of solutions. But unfortunately for many, that's not the case. And when they speak out, they end up becoming, ending up on blacklists. They go to the tenancy board and they end up on blacklists, which we know from the advocacy and work of Acorn Nova Scotia exists. And so I think when communities can band together and again, have these lived experience groups, peer-led groups who are helping to shape the solution and be part of the work, that's how you can build these plans. And wouldn't it be fantastic if we had the ability for people to access legal help when they experience these things with no fear for their own housing loss or for their own rights to be unmet. These are all part of the plan. You can work through your strategic planning, and you can work through your policies on how you can create those things. But that is something that we in our area we felt strongly about. And so we had a lived experience team that we compensated, and they went through all of our work and provided criticism. They provided feedback. They gave us, inspiration, insight, and knowledge. And really, they led a lot of the work that we're doing here now. And I'm very grateful for that, because it is groundbreaking and it will be transformational. It really will be. I really believe that. And that can help your community as well, I think. I don't know who had their hand up at first, if it was Emily or Susan, and I don't know if there's anything in the chat that requires me.
Nope, nothing in the
How
chat.
do
It
we
was
come up
Emily.
with- Okay.
Yeah.
Go ahead, Emily.
Thanks, Lisa. I work with Transition House, and by the name list is always something that is uniquely challenging for organizations like mine. And I was just wondering if you had any workarounds for those who there may be safety considerations should their name go to a list that's going to be shared around the community, specifically knowing that we are a rural community, smaller, and somebody's partner could be distributed. And I was just wondering if you had any insight on how workarounds could be developed.
Oh, yes. That's definitely something that I've encountered. And it is actually, it's quite important that when these systems are built, that there are methods to keep, especially when it comes to domestic violence and situations of safety, there has to be policies put in place to ensure that there wouldn't be accidental privacy breaches and that people are kept safe. So there's multiple ways that you can engage and still be part of the system. Some systems have set up policies where domestic violence shelters aren't, or anyone that is dealing with situations of unsafe, like safety concerns for family violence or domestic violence, they do not refer directly into the system. They have their own internal prioritization and by name list, and they would refer only aggregated data. And so they kind of keep everything in-house, but still share the data and resources, and the system itself works out so that resources can be allocated to, like, resources can still be shared and allocated to that by name list that is held in-house by the domestic violence provider or by the transition house provider. And it works kind of very fluidly, but again, it would require a position that kind of oversees the system, that communicates one-on-one, and then just shares aggregated forms of data. So by aggregated forms of data, I would mean like, there's this many people right now that are in transition house, and this is their, situation, not full detail, but they may be like, they have children, or they have, it's got to be information that is unidentifiable, but it still gives the community that information to be able to build their strategic planning. There are multiple ways to do it, and there's multiple community workarounds. And so if you do determine to go that route, if the community determines to take on coordinated access, that would be something that you and the community can iron out with the obviously the needs and concerns of the folks that you're serving forefront. You can also start groups, like if you have a group of people that are staying in your transition house that want to provide their feedback, they can become another, again, lived experience group that can help look through the work, provide their insight on what would work, what wouldn't, and also to provide some of their solutions of what they see would be best to serve the community. So it can give them voice and still keep their protection by keeping them anonymous and from everyone, but they can still be active participants if they so wish. Again, I know I'm not giving like a solid answer, but at least I want you to be aware that there are different methods that can help, and that can help bring everything together and still keep people safe.
Thank you.
Oh, you're welcome. Susan? Oh, you're muted.
Thank you. Thanks.
You're
so much.
welcome.
Really finding this so helpful, and I love the path with the plan. And I know we want to do it yesterday or today, but I keep thinking about the best time to plant a tree is 20 years ago, and the next best time is right now. So,
Right.
time passes, right? So I just want
Yes.
to jump in because I put a website on the chat. It's Housing Lab TC, and the TC stands for Truro Colchester, blogspot.com. And the reason I did that is I'm one of the organizers with the Provincial Green Party of Nova Scotia for this riding for Truro, Bible Hill, Millbrook, Seven River. And over the last year, so we've been having town halls trying to engage or trying to facilitate engagement, not engaging because people want to be engaged, but facilitate getting people together to make things happen. And it's been nonpartisan community events. The goal is much more, the goal is the key, right? Not who's organizing it. So this has mutated into, over the past 6 months, affordable housing, transportation, you know, the mesh of things that all go together. So at our last meeting, which was I think in late December, early November, and this was a community event, we had about a dozen people. One of the people, and this was like, what are we going to do? Do, you know, not just know and all that. So one of the members said, well, what I can do is to compile all those great little websites and resources that, isn't there something going on in Fredericton? And who's that group that does this? And didn't they already, right? So we thought, if nothing else, as a result of that meeting, we now have a website, and David Boehm and when you click on it, it'll say what it is. Anybody from here or any other meeting, if you find it useful, it's a resource, kind of a little library for resources, send them a note. So we don't have to keep looking these things up again and scratching our heads and losing time. So I think this is fabulous, and I'm certainly wanting to stay involved as a citizen, and thank you.
Oh, it was my pleasure. And I think that's exciting that you have that website. That's fantastic.
Yeah. Well, and
there's a lot of really, really cool things happening, right?
Yeah, and it's just citizens. As we're all here, just if everyone tries to shift something a little bit, then hopefully we'll get there. So thank you.
That's right. It was my pleasure. This is, I don't know, I'm sure it comes off, but this is really my passion as somebody, and I don't talk about it often, but as somebody who does have the lived experience of homelessness and the need for privacy in that situation of homelessness, I can tell you how frustrating from a worker perspective and from a lived perspective, how incredibly frustrating it was to try to navigate such a difficult, complex system to get basic needs met, and how tiring it is. And as a worker, when I was working in my street intervention program, that same fatigue kept coming back to me of the fight and having to fight and look and search, and how much time it took and how many of us were trying to do it together, but all in silos. When this project came to the city and we as agencies began to do the planning around it and the consideration of it, first of all, I can tell you that I didn't recognize until we were in a session that I had actually experienced homelessness in the past. I thought that was just, a situation. I hadn't really defined it. And so when I had that aha moment, all of a sudden it was just like this fire lit inside of me where I was like we have to do something. We've been doing the same thing for 30 years and it's not getting better. And so that's kind of like been what propels my work, and as well the folks that have come through my door and the ones that I have, that we've had to say goodbye to because of homelessness and because of the lack of assistance for people who use drugs, and the loss of life. I feel like right now as communities, we're all on that precipice of understanding from a deeply personal level that things have to change. It has to get better. We're losing too many people and it's all preventable. And this is my passion, to empower communities to be able to be creative and innovative and imaginative, and to include the people who are experiencing the issues we're trying to, address, because their voices are going to be the ones that are going to tell us whether or not things are successful, whether or not it's been tried before, what are the barriers, what do they see as their path forward. I always tell this story, and I'm going to tell it again. in the city of Moncton, we found through our coordinated access list, it was in the fall, moving into winter of 2018, that there was over 125 individuals that could not access the existing 2 shelters in our city because they had been banned due to use of drugs. And they had nowhere to go, and they were at risk of being left in the cold because they used drugs. We didn't have anywhere that offered, a damp, what they call damp or wet shelter space. And so we took that data and we advocated to the province and to the city that we needed to start something now because we were going to lose lives. And what ended up happening very, very quickly, 7 days, it was 7 days that we were told, you had to pull us together in 7 days or you lose your funding. We had to pull together an out of the cold model that would be incredibly low barrier and would allow people access 24 hours a day, 7 days a week, access to harm reduction supplies, a safe place to sleep, people to connect with, and to ensure that they were safe. We did it. It was awesome. It was very hard. I have been very vocal about the fact that me and all of my staff had to pursue counseling because of the things that happened and the things that we saw. But what I will tell you was the moment that it changed for me was when we were all standing around inside the shelter, and somebody made a passing comment to one of the individuals that was staying at the shelter that, they must be so happy because they didn't have to worry about freezing or being cold. That's what it was. And the young person looked at us and said, "I'm not afraid of being cold. What this place provides me is it was said in a different way, but what this place provides me is the ability to know that I'm not going to die alone, that somebody will be there if I end up overdosing, because we had put a plan in place that we weren't going to condemn or judge, that everything was there and available. If people needed to use, they could go and use, and we would have staff that would come and check on them and make sure they were safe. We had doctors coming in to check their wounds. Everything was just to meet them where they were, and they felt like they were going to be seen, that they wouldn't die by themselves if that was going to happen. And to me, that it still breaks my heart thinking that somebody has to worry about that. But at the same time, it meant that the work that we were doing, we had thought that everybody was there because they didn't want to be cold. What they were actually feeling was they wanted to be seen and they wanted to be heard. And they composed letters. They formed their own natural support groups and composed letters for us to bring to the province to advocate on their behalf using their words, because they weren't comfortable doing their own presentations. They were the ones that moved everything forward. Now we're in 2022, those same people are still stuck outside in the city of Moncton because they are still banned from the existing shelters, and we lost our funding to continue that space. But what I will tell you is when they talk to people, they always bring up the out of the cold shelter that saw them. They still carry letters that my staff gave to them, little messages of hope. They still carry them in their pockets. It's now 4 years later, and they're still holding on to these things because they were seen and they're moving forward in their own ways. I could tell you story after story of success that doesn't always appear to be success, but it is success because it moves the community forward and it pushes people into the understanding that there is hope and that they have the capacity to move themselves forward, that they are seen and that we will support them. This is what drives this work. It's not just the data, it's bringing everyone together and to tell our community, we see you and we're here to break down those barriers so that you can make your own path forward, so that you can see your own dreams forward, not the dreams I have for you, but the dreams you have for yourself and the path that you have for yourself. This is how we as a community plan out those paths. And this is why we'll see success, because anyone who's invested in their own plan will see it to the end. They're invested in it just as much as you are and your funding is. And I think that's powerful. Go ahead, Wayne. I think you have your hand up there.
Yeah, I wanted to ask a question about funding and your thoughts around it. As it's currently constructed, the money comes from the feds. It's given to the province, and then the province makes decisions on how it's to be distributed. In the late 80s, early 90s, I worked as a senior executive with the federal government in Ottawa and human resource development, and we had the homeless file. And it, quite honestly, it doesn't seem like the yardstick has moved very far in that number of years. And I don't know if just a brighter light is being shone on the situation, and so more people are aware, or if our approaches haven't really worked. And I noticed Dr. Ellis is on the call too, and that's why I'm bringing up the feds and the funding, because I'd like to hear his perspective.
I'm not sure if they're able to speak to that. I mean, if they want to jump in, I'm more than happy for them to jump in. I can tell you that I don't think that the needle has moved forward. And a part of that would be the policy changes that happened around that same time that you were speaking of, on the federal government's responsibility to develop and increase housing, so that we talk a lot about how that policy change really ramped up what we're seeing now. We're seeing kind of like the results of those policy changes now more broadly than ever. There's a few policy changes that we're seeing the results of, but that's one of them. And I do think that you're right. I think that for a long time, we've all held a charitable model where we, provide things, the handouts, without really investing in the supports. When we house people, they have to have a support system in place. We have to have a support system wrapped around each person to ensure that they're successful and that their needs are being met and their goals are being met and they're moving forward. And that all comes through funding. So there's different various ways of funding. You can have funding through the Reaching Home Funding Pot, which is distributed by the federal government through the Affordable Housing Association of Nova Scotia. There's also various funding pots through the province of Nova Scotia in their homelessness department. And then also, I think we need to advocate a little bit more strongly, and we can use, again, the data that we receive to craft those plans to have funding from the mental health and addictions pots, because we know that we're serving a lot of their folks and they're not able to access some of the services that are being offered. So there's a lot of funding streams. It's just a matter of putting together a community plan and to see what you're going to need to be able to move this forward. And then we can make a strategy. I have a lot of templates that I provide to different lived experience groups on helping them build their capacity for visioning and for sharing their voice. And I also share that with communities so that they can build their advocacy plan and their strategic planning. And it helps kind of just move forward on like identifying what you're going to need. So then you understand your resources, what you have, and what you might need additionally, and then craft creative funding plans for that. Other communities, I should also mention very quickly, other communities have established community wealth funds. So community pots of money that is given to, by donors to be able to be replenished and shared equitably throughout the community. And it can be used for many different things, but it's there and it helps create that sustainability, and also social enterprises. I will recommend a book that I think every single person needs to read right now. And it's called The Beautiful Bailout by Sean Loney. If you haven't heard of Sean Loney, you need to look him up. He is incredible. And this book is a powerful tool to help all of us understand the capacity that I think the pinnacle that we're at right now in building sustainability in our nonprofits and in the work that we're doing, and increasing our financial capacity to move away from relying on different funding pots that always end and they never really fund us efficiently. So if you can get any book, get that book, The Beautiful Bailout by Sean Loney. The other book that I recommend usually is Upstream by Dan Heath. I think that it's a powerful, again, another powerful book that helps us start to change our mind from crisis-driven response into upstream thinking. Like what the Archbishop Desmond Tutu said, like we're constantly pulling people out of the river, but we need somebody to go upstream and see why they're falling in and to stop that. This helps us build that, that kind of philosophy and that ethic into the work that we do. Sarah, you have your hand up. Juliana has her hand up. I don't know who was first.
I'm just, sorry, Councillor Bernard, I'm just going to hop in real quick. Councillor Talbot, Dr. Ellis had mentioned in the chat for you to give the office a call, and he'd be happy to chat with you.
Yes, I
around
saw
your
that and I
question.
responded.
Okay.
Thank you.
Oh, perfect. And also, I just wanted to acknowledge that Carol Eisner from Maggie's Place did ask a question up a little bit just around resources for landlords and getting that information out to them. So maybe after Councillor Bernard, we can go to your Esther's favorite story around working with landlords and energy poverty and how that helped the community of Bridgewater.
Thank you, Sarah. And I first just want to thank you, you and Esther and everyone who's been working on this, and thank Lisa for a really powerful presentation today. And I'm so impressed and I'm so excited about the possibilities we have here. If you just look at the, the names in the circle or the squares, we have MLAs, we have MPs, we have municipal councilors, we have staff, we have organizations, citizens. So I think, it's very exciting what we will be able to do. I'm saying will. So I guess I just have a couple of questions and comments. One is I'm really excited about that global view that sustainability includes affordable housing, it includes the energy, it includes the environment, it includes social sustainability and economic, this will contribute to a sustainable economy for our region as well. So it's really a holistic approach. I'm very excited about that. And I'm also excited about, that we get to act. I've been a counselor for just over a year now, and I find I love being on council and being at the service of the community. And sometimes it's frustrating because you feel like you can't, you don't have a magic wand to solve these huge problems. So I'm really excited that there's people from different levels of government here. And my hope is that moving forward with this strategy, we can continue to collaborate intergovernmentally. I feel that would be really important. So maybe I can get in on that call, Wayne. Anyway, or you can, we can figure out a way to communicate with one another. So I guess my question now is, what do we need to do to go forward? I feel like this strategy that's being presented today is really addressing what needs to happen. So I guess, I'd ask, we have 3 municipalities, there's a lot of intersections, we have Truro, we have Colchester, we have Stuyak, we might have something else or somebody else that I'm not mentioning, sorry if so. We have different MLAs, we have, the federal level. So what would be needed from each of those levels? Like Lisa, you were saying, if the community adopts this strategy, so what do we need to do? Well, I would love.
So
us
what's your
to
next
what we need to
steps?
do? Yeah, to get it to happen.
Well, I would say your immediate next step will be to respond to the survey that will go out. Is 5 questions, and it's going to gauge your interest in the capacity that you have to take part in forming a strategic planning team. Once that's done, then there will be facilitated conversations that will happen where you'll have work that you'll have to actually plan out as a group to be able to start moving forward on planning some of those policies that will get you started. And then you can move straight into, actually implementing a system and putting it together. So it sometimes doesn't always feel like immediate action for the first planning part, but it's moving towards that launch, right? So yeah, I guess your first next step is responding if you're interested in participating to that survey. And then from there, we begin to identify who's missing from the group. It's again, it's very important to ensure that you have the lived experience and none of these roles can be in token, they're not token representation, they're active members of the system. So you want to make sure that you have representation and active members in your system and your planning from, again, people with lived experience, You're going to want to have African Nova Scotian representation. You're going to want to make sure you have Indigenous leadership. All of this comes together because we're not the gatekeepers of it. It has to be community driven. And again, as long as you're building that into your work plan and how you approach this, yeah, the sky's the limits of where you can go, really. But yeah, it's exciting. I get excited knowing that, rural communities are wanting to take this on. And it doesn't surprise me as somebody who grew up in a rural community. There's a lot of resiliency and creativity that happens in rural communities to make things happen. So I'm not surprised that the rural communities of Nova Scotia are willing to take this on and lead that change. Yeah, I hope that helps answer some of your next steps.
Yes, thank you.
Okay, so Esther, I think that she wanted me to tell something about I'm sorry, you'll have to go back and remind me of your favorite story because I have too many in my head right now.
Yeah.
Or why don't you share it? You share it.
Okay, fill in the gaps if I forget something. So something I was kind of stalking Lisa and other presentations she had done just to see what it was like. And one of the examples she gave to the group, and as she was explaining coordinated access, was based on the intake process that they do for the system, making sure that you have all that information that we previously saw with the other examples of who would be the best fit to house. Something could come up such as, okay, this individual just doesn't have enough money to cover the rent. So instead of just being like, okay, well, here you go, here's some money, cover the rent, it could be something that is constantly happening. It can be an issue for the next month. So instead of just, kind of putting on that Band-Aid, there's more questions to get more, deeper into the issues. What is causing you to not have the funds needed to cover your rent? And so in this particular example, it was that the energy bill was just too high. And by the time they paid it off, they didn't have enough money to cover other expenses. So instead of just saying, oh, here's some money, and then the issue still continuing, what they ended up doing is they had a staff member who was able to reach out to that particular landlord to let them know of the resources available for them to, I guess, retrofit or, have some energy saving materials that they can use, to help pay for that, so that they're able to lower the cost for energy. But the really cool thing about that was, like, let's say that landlord owns 20 units. You've just connected with the landlord who can, be able to use these resources for all the 20 units. So you're not just helping that one individual that you're working on at the particular time, but potentially 20 other families that could be directly affected by this, this resource, this change. And so not only are you just supporting this one person, but like all of a sudden, boom, you have 20 people who can then share that success with each other, and potentially other landlords can share that with them, each other as well, to say, hey, did you know there's this resource? You should totally check it out. And anyway, I really like that ripple effect of it. It's not just you're just supporting that one person. Like, there really is potential to have a wider impact, because we're not just putting Band-Aid on it. We're really looking at the core issue and how can we support them so that this doesn't continue to happen. I think that's one of the biggest things that I'm really excited about for this system. So, I don't know if I missed anything there, Lisa.
No, you did great. And yeah, so the reason why Bridgewater is able to do that is because they tied the creation of a coordinated access system to Energize Bridgewater, which is a project that is to help address local energy poverty issues by offering retrofits and funding for homeowners and landlords to be able to do to their buildings to keep people housed longer and to lower energy costs and energy waste. And so again, what Esther was talking about was there's a crisis that comes forward. You can then use the system for prevention. So you can address a crisis and then you can prevent the crisis from happening again. And in the case of a landlord with multiple units, you can then address the crisis for the 20 other tenants that they have, because before it even happens, because if one unit is one unit in the same building is experiencing a massive energy inefficiency, then we can know that all of the other units are, and they're likely struggling to pay all of their bills and, doing that, what's that saying, robbing Peter to pay Paul, or Paul to pay Peter. I don't know. That's saying that people say sometimes. I don't really know what it is. I just, but that's what most people do to try to make ends meet. This gives us a way to help empower, again, everyone, and to stop that cycle before it even starts. So you can use creative ideas when you're looking at your data and how you implement your system. You can look at the resources you already have. You can also look at what is happening that would help benefit. Environmentalism and energy efficiency are both big things right now, along with housing affordability. We can combine these things to be able to be a force that actually impacts our community on a broader scale than if we just are accessing, the homelessness, which is like this big, like the pot of money is so small. But there's other things that we can address, especially in our planning, and make these creative solutions.
So I guess, Carol, that's the short answer is yes. The hope is to be able to have information to provide to landlords that they can also efficiently and effectively upgrade units or look for other resources to help not only work with us with coordinated access, but also looking at smarter ways for them to operate as well.
Yeah. This is really exciting. Everyone here, like, I love the message from Krista. I don't know if anyone saw in the chat, but just talking about the struggle and how long, they've been advocating for, and again, that pain of how many people they've lost to things that are so preventable. Like, I understand that grief. I just had to go through that 2 weeks ago when I was told that somebody that I knew passed away. And it's always hard. Like, it's always hard, especially when you're like, it was preventable. It could have been addressed so long ago, and yet it hasn't been. And that grief carries through our communities, but we can empower ourselves to be those solutions. We can empower our communities to become those solutions. And I think the sheer number of people who are here today, like, this is like I think this is the largest group I've done a presentation to that are keenly interested in coordinated access. I strongly believe that you're on the path to doing something that will be very, very much a huge impact to your community. And again, set the stage where you can be leaders in this movement. So I'm really excited to see where things go for your community. I know that we were booked till 1 o'clock, but I also know people have very busy lives, so I don't want to keep anyone longer than we need to. They'll get a follow-up email either through Sarah or Esther that will include my slides. It will include my contact information, and it will include the link to the survey, just asking for your interest in participation. But before we say our goodbyes, I did want to just kind of put out one more call if anyone has any questions or anything they wanted to ask or share. And again, if you're not comfortable doing it in a group setting, please feel free to email me. I'm happy to answer anything one-on-one. But I did want to give one more opportunity just in case. This is a great conversation.
I just wanted to ask a question whether or not any of the government agencies are involved, like CMHC, for example, who offers a program that a lot of the developers work with. Are they part of this process?
They wouldn't be part of planning out your coordinated access system, but your coordinated access system and the CMHC can work together in developing housing. So once you have the tools and the data in place, and the kind of housing, if you determine a housing model that would best suit your needs, you can use that to create your plan and get seed funding through the CMHC to kind of start that development. I also mentioned the CHTC, the Canada Housing Transformation Center. They have seed funding where you can apply and have strategic planners come, or consultants come and help you do your business models. They also have capital funding. So again, it's not shovels in the ground funding. It's more like you can hire you can hire like an architect to do your designs, and they'll fund all of those things. All of those can work together, but you can use your data that you're gathering and the information through the system that you gather to help formulate your plan and your idea to provide to them. So they're not, again, they wouldn't be sitting at your table, but they will become resources to your table and to the system by being able to provide, different funding pots for your area. And the municipality would be in a great position to support that work and to even be able to, let's say, apply for those funding pots or host, your strategic planning person if the community has that trust and that established relationship already. There's lots of things that you can do with them. Did anybody else have anything they'd like to add? No?
Great. Well, I just want to say thank you, Lisa, so much for sharing with us your knowledge, but also your lived and professional experience on top of just a great overview of coordinated access and why it's so important. I think anyone that knows me knows how much of an interest I have in this area and the work that's being done. And I feel, as someone who grew up in this community and lived here for a long time, just recognizing the interest and what people are bringing to the table. And I can't thank you all enough for giving time this morning. I feel so hopeful knowing that, and I have consistently moving in the right direction and moving forward. And I can recognize the frustration sometimes of things aren't moving fast enough and we're not, it's not all happening tomorrow, and knowing we feel it too. But please reach out to either Esther or myself at any point in time that, you have questions, or if there's anything that we could be doing differently or anything. We are always open to suggestions and feedback, and hope that you all feel confident in the work that we're doing and bringing on consultants like Lisa to our community to help lead this work. So we're very excited to see where things will go next steps. And again, thank you all so much for your time today.
Thanks for having me. Look forward to the email that will be sent out soon. Have a great rest of your day, everyone.